Hello everyone, welcome back to my channel. It's True Wellness Hub. If you're over 50 and your lower back aches every time you stand up, walk for too long, or even just get out of the car, listen up. The real problem might not be your back at all. It might actually be your glutes. If you fix them, you might finally find the relief you've been looking for. Lower back pain after 50 is so incredibly common that most people just accept it as a normal part of aging. You wake up feeling stiff. You start avoiding those long, enjoyable walks. You find yourself sitting down very carefully. Maybe you've even been told by a doctor that you have wear and tear, disc degeneration, or arthritis. And while those conditions can certainly be real, here's what most people are never told. One of the biggest drivers of lower back pain after 50 is weak, inactive glute muscles. Your glutes, especially the gluteus maximus and gluteus medius, are the largest and most powerful muscles in your entire body. They're specifically designed to extend your hips, stabilize your pelvis, and protect your spine whenever you move. But after 50, a few things happen. We tend to sit more, do less strength training, and experience hormonal changes. On top of that, there's a natural muscle loss called sarcopenia. All of these factors combined cause these crucial muscles to become weaker and slower to activate. And here's the key. When your glutes don't do their job, your lower back tries to do it for them. Think about what happens when you stand up from a chair. Ideally, your glutes should be the primary engine powering that movement by extending your hips. But if your glutes are weak, your lower back muscles, especially the erector spinae, have to step in and compensate. Over time, that constant compensation leads to tightness, fatigue, inflammation, and eventually, chronic pain. It's like asking a small motor to do the work of a giant engine. Eventually, it's going to burn out. The same thing happens when you walk. Each step you take should be supported by your glutes, which work to keep your pelvis stable and level. If they're not strong enough, your hips might drop slightly from side to side with each step. This creates a subtle instability that forces your lower back to work overtime just to keep you upright. Now, multiply that extra effort by thousands of steps a day, and you can start to see why your back might be constantly irritated and painful. This isn't just a theory. It's backed by science. Research in biomechanics consistently shows that people with chronic low back pain often have delayed or reduced glute activation. In simple terms, their glutes either fire too late or not strongly enough during everyday movements. That delay directly shifts the load and stress onto the lumbar spine. Over weeks, months, and years, the spine becomes overloaded, and that's when the persistent pain sets in. But here is the most empowering part of this whole story. Muscles can change at any age. It doesn't matter if you're in your 60s, 70s, or even beyond. Your body has an incredible capacity to rebuild strength and improve its activation patterns. You are absolutely not too old to strengthen your glutes. And when you do, the relief from back pain can be truly dramatic. So, before we dive into the specific exercises that can help, let us quickly talk about some of the common signs that your glutes might not be doing their job properly. The first sign is that your lower back feels tight or tired after just standing for a while. I'm not talking about a sharp, stabbing pain, but more of that dull, nagging fatigue that just won't go away. The second sign is feeling unstable when you walk, especially when you going up or down stairs or walking on uneven ground like a grassy park or a cobblestone street. A third sign is struggling to stand up from low chairs or couches without using your hands to push yourself up. If you find yourself needing that extra boost, it's a strong indicator that your glutes aren't providing the power they should. And the fourth sign is noticing your posture shifting forward over time. You might see your hips tucking under and your shoulders rounding. This is often your body's way of compensating for a weak posterior chain, which is anchored by your glutes. If any of these sound familiar, it's a very good sign that your back pain is linked to weak or underactive glutes. So, how do we fix this? The solution isn't about doing intense, heavy workouts. It's about re-educating your muscles. You need to wake up the glutes first, then strengthen them. This is a two-step process: activation, then integration. Activation exercises are gentle movements designed to get your brain reconnected to your glute muscles. Integration is about teaching them to work correctly during bigger movements. Let's start with a foundational activation exercise, the glute bridge. Lie on your back with your knees bent, Feet flat on the floor about hip width apart, and your arms by your sides. Before you even move, I want you to focus on gently squeezing your glutes. Try to isolate them. Once you feel them engage, slowly lift your hips off the floor until your body forms a straight line from your shoulders to your knees. Hold it for a couple of seconds at the top, squeezing your glutes the entire time. Make sure you're not arching your lower back. The work should come from your hips. Then slowly lower back down to about 10 to 15 repetitions. This is the perfect exercise to start with because it teaches your glutes to fire without your lower back taking over. Next, let's move on to the clamshell. This one is fantastic for targeting the gluteus medius, that side glute muscle that's so important for pelvic stability. Lie on your side with your knees bent at about a 90-degree angle, with your feet and hips stacked on top of each other. Keeping your feet together, lift your top knee towards the ceiling, like you're opening a clamshell. The key here is to not let your hips rock backward. The movement should be small and controlled, purely from the hip rotation. You should feel a gentle burn on the side of your hip. Do 15 reps on each side. Once you've mastered these activation exercises and you can really feel your glutes working, it's time to integrate that strength into more functional movements. A great one to start with is the bodyweight squat. Stand with your feet shoulder width apart, toes pointing slightly out. Initiate the movement by pushing your hips back as if you're about to sit in a chair that's way behind you. Keep your chest up and your back straight. Lower yourself down as far as you comfortably can, then drive through your heels and squeeze your glutes to stand back up. The focus is on that powerful glute squeeze at the top of the movement. Remember, consistency is far more important than intensity.
Okay.
Doing these simple exercises a few times a week can make a world of difference. It's about retraining your body's movement patterns, and that takes time and repetition. Don't get discouraged if you don't feel a huge change overnight. Stick with it, and gradually your glutes will learn to do their job again, taking the pressure off your lower back. Strengthening your glutes isn't just about relieving pain. It's about reclaiming your freedom. This means being able to go for long walks again, play with your grandkids on the floor, and get through your day without that constant nagging ache. You have the power to make a change, and it starts with these simple, targeted movements. There's also a neurological component. When you sit for long periods, which many adults over 50 do, your hip flexors stay shortened, and your glutes stay lengthened and inactive. Over time, your brain literally gets worse at recruiting them. It's sometimes called gluteal amnesia. The muscle isn't gone, it's just not being used efficiently. And here's where things get interesting. Strengthening your glutes doesn't just reduce strain on your back mechanically. It also improves blood flow, reduces inflammatory signaling, and enhances coordination between muscle groups. Your body starts distributing forces more evenly. The spine doesn't feel like it's carrying the entire load of your daily life. Let's break down the science in simple terms. Your spine is designed for stability, not heavy lifting. Your hips are designed for power. When the hips lose power, the spine tries to become powerful, and that's when trouble starts. By restoring hip strength, especially glute strength, you return each body part to its proper role. Imagine carrying groceries. If your glutes are strong, they help you hinge at the hips, keeping your spine neutral and safe. If they're weak, you round your lower back, increasing pressure on discs and joints. Over months and years, that repeated stress adds up. The good news is that it doesn't take extreme workouts to fix this. It takes consistency and the right movements. The first key is activation. Before you load your glutes, you need to wake them up. One simple exercise is the glute bridge. Lie on your back with knees bent and feet flat on the floor. Slowly press through your heels and lift your hips toward the ceiling. But here's the important part. Focus on squeezing your glutes, not arching your back. At the top, your body should form a straight line from shoulders to knees. Hold for 2 seconds. Lower slowly. Do this for 10 to 12 controlled repetitions. This movement retrains your brain to fire your glutes during hip extension. For many people over 50, just practicing this daily begins to reduce back tension within a few weeks. The second exercise is the side-lying leg raise, which targets the gluteus medius, a critical stabilizer. Lie on your side, legs stacked. Keeping your top leg straight, lift it slightly upward without rotating your hips. You don't need to lift high. Small, controlled movement is enough. This strengthens the muscle that keeps your pelvis level when you walk. A stronger glute medius means less side-to-side sway, which means less twisting stress on your lower back. The third movement is the hip hinge pattern, often practiced as a bodyweight Romanian deadlift. Stand tall, place your hands on your hips, and gently push your hips backward while keeping your spine neutral. You should feel a stretch in the back of your thighs. Then squeeze your glutes to return to standing. This teaches your body to bend from the hips instead of the spine. This pattern alone can completely change how you pick things up from the floor. Now, here is something many people over 50 worry about. Is it safe for me to strengthen my glutes if I already have back pain? In most cases, yes, if you start gently and focus on form. In fact, clinical guidelines for chronic low back pain consistently recommend strengthening and movement over rest. The key is gradual progression. Pain should not spike sharply during exercise. Mild muscle fatigue is fine. Sharp spinal pain is not. Another powerful benefit of glute training after 50 is improved bone density. Resistance training stimulates bone remodeling. When you load your hips safely, you also stimulate the pelvis and femur areas prone to osteoporosis. So you're not just helping your back, you're strengthening your skeletal system. Hormonal changes also play a role here. After 50, lower estrogen in women and lower testosterone in men contribute to muscle loss and reduced connective tissue resilience. Strength training, especially for large muscles like the glutes, helps counteract this decline by improving muscle protein synthesis. In simpler terms, strong glutes help your whole body age better. But let's address expectations. How long does it take to notice improvement? Many people feel subtle relief within 2 to 4 weeks of consistent training. Significant strength gains often appear around 6 to 8 weeks. Remember, your nervous system adapts first, meaning your brain gets better at using existing muscle before the muscle visibly grows. Consistency beats intensity every time. It's also important to combine glute strengthening with mobility work. Tight hip flexors can inhibit glute activation. A simple half-kneeling hip flexor stretch held for 20 to 30 seconds on each side can make your strengthening exercises more effective. And don't forget walking. Walking with intentional glute engagement, gently squeezing as you push off each step, reinforces the pattern throughout the day. Now, there's one more piece people often overlook: core coordination. Your glutes don't work alone. They function as part of a system that includes your deep abdominal muscles and diaphragm. When you exhale gently during effort, like at the top of a bridge, you create better spinal stability. This reduces pressure and protects sensitive structures. Your body is not a collection of isolated parts. It's an integrated system. When the hips regain strength, the spine can finally relax. And this shift doesn't just change pain levels, it changes confidence. People who rebuild hip strength often report feeling steadier, taller, and more capable in daily life. They're less afraid of bending down, less hesitant on stairs, more willing to stay active. Movement stops feeling dangerous and starts feeling empowering again. We're going to go deeper into how to build a simple weekly routine that supports your back long term, and how to avoid the most common mistakes people make when trying to strengthen their glutes after 50. When you start rebuilding glute strength after 50, the goal isn't to train like you're 25. It's to train intelligently, consistently, and in a way your joints can tolerate. The biggest mistake people make is either doing nothing because they're afraid of pain, or jumping into aggressive workouts that flare things up. Let's build this the smart way. First, frequency. 2 to 3 focused glute sessions per week is enough. You don't need daily, intense workouts. Muscles over 50 still respond beautifully to resistance, but they also need recovery. In fact, recovery becomes even more important with age because tissue repair is slightly slower than it was in your 30s. A simple weekly structure could look like this: Monday and Thursday. You do 20 to 25 minutes of glute-focused strength work. On other days, you walk, stretch, and stay gently active. That's it. Nothing extreme. Second, progression. Your body adapts when you gradually increase challenge. Start with body weight movements like bridges, side leg raises, and hip hinges. When those feel easy and controlled, you can add light resistance, maybe a resistance band around your knees during bridges, or holding light dumbbells during hip hinges. The key is control. If your lower back feels like it's taking over, the weight is too heavy, or the movement pattern needs refinement. Now let us talk about posture. because posture after 50 often shifts in subtle ways that affect glute function. As we age, many of us develop what is called a posterior pelvic tilt, where the hips tuck slightly under the body. This flattens the natural curve of the lower back. In that position, the glutes are actually placed in a shortened state, which makes it harder for them to generate force. On the other hand, some people develop excessive anterior pelvic tilt, where the hips tip forward and the lower back arches more than normal. In this case, the glutes are lengthened and inhibited, while hip flexors and lower back muscles become tight. In both cases, the solution isn't to obsess over perfect posture. It's to restore balance, strength, and mobility so your pelvis can move freely and stabilize naturally. One of the most powerful exercises for this is the split squat. It sounds advanced, but it can be modified easily. Stand in a staggered stance, one foot forward and one back. Slowly bend both knees, lowering your body straight down. Most of your weight should be in the front heel. Then press through that heel and squeeze the glute of the front leg to stand back up. This exercise builds strength in a way that closely mimics real-life movement, climbing stairs, stepping onto curbs, getting up from the ground. It challenges stability and power at the same time. And because it's unilateral, one leg at a time, it corrects imbalances that often contribute to back pain. Another important point: don't ignore your hamstrings. They work closely with your glutes to extend the hips. Weak hamstrings can also shift strain upward into the lower back. Simple movements like supported hamstring curls or controlled hip hinges help create that balanced support system. Now, let's address fear. Many adults over 50 move cautiously because they've experienced pain before. That caution is understandable. But long-term avoidance can make the problem worse. Muscles shrink when they're not used. Joints stiffen. Nervous system becomes more sensitive. Pain does not always equal damage, especially in chronic back pain. Research shows that the nervous system can become hypersensitive even when tissues are not severely injured. Gentle, progressive strength training sends a powerful message to the brain. This area is strong, supported, and safe to use. Over time, that message reduces protective tension in the lower back. You may notice something interesting as your glutes get stronger. Your walking speed increases slightly without effort. You feel more stable carrying groceries. May even notice improved balance. Because the glutes are major contributors to dynamic stability, the ability to control your body while moving. Balance is not just an ankle issue, it's a hip issue. Stronger glutes also reduce fall risk. After 50, maintaining independence becomes closely tied to lower body strength. Studies consistently show that hip strength predicts mobility and resilience later in life. By training your glutes, you're not just preventing back pain, you're investing in long-term function. Let's also talk about sitting. You don't have to eliminate sitting. That's unrealistic. But breaking up prolonged sitting every 30 to 60 minutes with brief movement can dramatically improve glute activation. Even standing up and performing 10 slow bodyweight hinges can remind your glutes to stay online throughout the day. Small habits compound. Sleep matters too. Muscle repair happens during deep sleep. If you're training but sleeping poorly, progress will feel slower. Prioritize consistent sleep routines, especially since hormonal shifts after 50 can disrupt sleep quality. Strong muscles are built at night, not during the workout itself. Nutrition plays a role as well. Adequate protein intake supports muscle maintenance and growth. Many adults over 50 unintentionally underconsume protein. Spreading protein intake evenly across meals helps maximize muscle protein synthesis. Now let's bring this all together. When your glutes are weak, your lower back becomes overworked. When your glutes are strong, your hips reclaim their role as the engine of movement. Your spine can focus on stability instead of force production. Pressure on discs decreases. Muscle tension balances out. Movement becomes smoother. This is not about building a bodybuilder physique. It's about restoring function. Here's something powerful. Improvements in strength often improve mood and energy. Resistance training increases circulation, stimulates beneficial hormones, and enhances confidence. When you feel physically capable, your perception of pain often decreases. The body and brain are deeply connected. If you stay consistent for 8 weeks, just 8 weeks, you may notice that getting out of bed feels easier. Standing from a chair requires less effort. Long walks create less tension in your back. That's not magic. It's biomechanics and neuroplasticity working in your favor. Your body is incredibly adaptable even after 50, especially after 50. The biggest shift is mental. Instead of thinking my back is fragile, begin thinking my hips need strength. That small reframing changes how you approach movement. You're not broken. You're deconditioned in specific areas. And deconditioning can be reversed. If you're over 50 and dealing with recurring lower back discomfort, your primary goal for the next 8 weeks is not intensity. It's reconnection and rebuilding. Step 1 is daily activation. 5 minutes. That's it. Every morning or before a walk, perform 10 to 15 glute bridges, slow and controlled. Add 10 side-lying leg raises per side. Focus on feeling the muscles working, not just completing repetitions. This daily signal keeps the brain-to-muscle connection strong. Step 2 is strength training 2 to 3 times per week. Start each session with bridges again, this time maybe 2 sets instead of 1. Then move to hip hinges, 8 to 10 slow repetitions for 2 or 3 sets. Then split squats, 6 to 8 repetitions per side. If needed, hold onto a chair or wall for balance. Let's finish with another set of bridges or a gentle hamstring movement. That's your entire program. No machines required. No extreme movements, just foundational patterns repeated consistently. Now, how do you know it's working? First sign, you feel your glutes working during daily activities. When you climb stairs, you notice a subtle push from your hips instead of strain in your lower back. Second sign, your back feels less tired at the end of the day. Not necessarily zero discomfort overnight, but a gradual reduction in that constant fatigue. Third sign, improved balance. You may notice you can stand on one leg more confidently while putting on shoes. Progress isn't always dramatic. Sometimes it's subtle shifts that accumulate. Now let's talk about discomfort during training. A mild muscular burn in your glutes? Good. Slight soreness the next day? Normal. Sharp pain in the spine? That's a sign to reduce load, improve form, or consult a professional. Strengthening should challenge muscles, not irritate joints. If you've had significant injuries, spinal surgeries, or severe osteoporosis, always work with a healthcare provider before starting. But for most people with general, age-related back discomfort, gradual glute strengthening is not only safe, it's recommended in modern rehabilitation guidelines. There's something else important here. After 50, many people unknowingly move less because of fear of pain. That reduction in movement accelerates muscle loss. Muscle loss reduces stability. Reduced stability increases discomfort. It becomes a cycle. Strength training interrupts that cycle. It reminds your nervous system that your body is capable. It restores force where it belongs, in the hips. It decreases protective guarding in the lower back. It builds resilience, not just pain relief. Strong glutes also improve how you absorb force. Think about stepping off a curb. If your hips are strong, they absorb that load smoothly. If they're weak, the force transfers upward into your spine. Over thousands of repetitions, that difference matters. And here's something that doesn't get talked about enough. Confidence changes movement quality. When you trust your body, you move more fluidly. When you're afraid, you stiffen. That stiffness often increases strain on the lower back. By strengthening your hips, you rebuild trust in your body's ability to handle daily life. This is about more than muscles. It's about restoring freedom. You don't need to eliminate aging. You need to adapt intelligently to it. Muscle mass naturally declines with age, but resistance training slows and can partially reverse that decline. Neural coordination decreases with inactivity, but it improves quickly with practice. Bone density drops gradually, but loading the hips stimulates maintenance. Your body responds to stimulus at every decade of life. If you commit to consistent glute strengthening for 2 months, you're not just treating back pain, you're building a foundation that supports everything else: walking, lifting, playing with grandchildren, traveling, staying independent. And here's the beautiful part. The glutes are forgiving. They respond well to simple movements. They don't require complicated equipment. They just require attention. Back pain after 50 is often treated like an unavoidable companion. But in many cases, it's a signal not of damage but of imbalance. When the hips regain strength, the spine finally gets relief. Imagine standing taller without trying, walking longer without that familiar ache creeping in, getting out of a chair without bracing yourself first. That's what happens when the right muscles start doing their job again. Your back doesn't need to work so hard anymore. When it doesn't, everything feels lighter. Here's the truth most people never hear after 50. Your back is not the villain. It's the messenger. For years, it may have been absorbing forces your hips were designed to handle. It tightened to protect you. It worked overtime when other muscles went offline. And eventually, it started sending signals: discomfort, stiffness, fatigue, asking for support. When you strengthen your glutes, you're not just building muscle, you're restoring balance, you're redistributing load. You're teaching your nervous system that movement is safe again, and that changes everything. Back pain after 50 is often less about age and more about adaptation. The body adapts to sitting, it adapts to inactivity, but it also adapts to strength. It adapts to consistency, adapts to intelligent training. 2 or 3 short sessions a week, 5 minutes of daily activation. Simple movements done well. That's enough to begin shifting how your entire body feels. Imagine 8 weeks from now, you stand up without hesitation. You walk without that dull ache following you. You bend down with more confidence. Your posture feels more natural. Not forced, just supported. That's not unrealistic. That's physiology. Your hips are meant to be powerful. Your spine is meant to be stable. When each does its job, pain often fades into the background. And maybe the most important shift is this. Instead of seeing yourself as someone with a bad back, you begin to see yourself as someone rebuilding strength. Because you're not fragile, you're adaptable. You're capable of change at 50, 60, 70, and beyond. If your lower back has been asking for help, don't just stretch it. Don't just brace it. Strengthen the muscles that were meant to carry the load in the first place. Turn your glutes back on. Give your spine a break. And let your body remind you what it's still capable of. Thank you so much for watching. I hope this information empowers you to take control of your back pain. If you found this helpful, please give it a thumbs up and subscribe to True Wellness Hub for more tips on how to live a healthier, more active life after 50. See you in the next video.